Hello, this is the chapter about amniotic fluid embolism, one of the most rare and obstetric emergency in which amniotic fluid, fetal cell, hair, or other debris that somehow enter the maternal circulation and obstruct the primary vessel, causing this respiratory distress and circulatory collapse. These two are the main words which are used in the amniotic fluid embolism. Now, what are the causes? Etiology, we can say intrauterine fetal death. The baby is dead, and from there, the maybe some infection maybe pass into the maternal circulation, or short labor in which maybe trauma can occur. From the trauma it can pass easily, and placenta accreta, the uterine wall in which endometrium should be passed in implantation, should be in implantation should be done in the endometrium, but somehow it is done in myometrium. It can occur. And polyhydramnios, a history of allergy can be done. Chorioamnitis, ascending infection from vagina to uterus. Oxytocin induction can be occur, leading to short labor. And then meconium staining liquid, the somehow fetal become distressed, and he or she can pass the meconium, and in which the amniotic fluid becomes stained, and trauma can occur. What are the signs and symptoms? At first, pulmonary edema, respiratory arrest. It can be the symptoms of shock too, that is sinuses, cough, and dyspnea. Restlessness also can be occurred, and hypertension due to the blockage of passing the blood into the other part of the body. And tachycardia can occur due to the low blood coming to the heart and leading to pump faster than usual. And then shock can occur, and cardiac arrest can occur due to the blockage in the embolism in the heart. What may be the management? Obviously, IV infusion can be given, O2 administration, oxygen administration can be given. And if the patient doesn't have have loss of consciousness, or his level of consciousness is low, her we can do airway control by intratracheal intubation and provide ventilation and oxygen. And we can provide blood sample like ABG to assess the metabolic acidosis or alkalosis. We can see CBC, and then prothrombin time and partial prothrombin time, fibrinogen and FDP. We can also place the Foley catheter and monitor the urine output. We can also correct the hypertension by infusion of dopamine. And we can also monitor the cardiac system, which is ECG and CO2 we can see, and urine output as usual. We can also correct the coagulopathy by giving fresh frozen plasma. And what may be the complication if we didn't timely manage? There will be cardiopulmonary failure, and then DIC means disseminated intravascular coagulation. And acute renal failure can also occur due to the hypotension, and then neurological complications. Thank you.